Today's program is about how to launch and grow a successful simulation program. And we're going to hear from Lance about both sides of that. How do you get started? And then once you're started, how do you really pull that into the culture? How do you embed that in your the way you do process improvement, the way you approach quality and safety? How do you really grow that program successfully? So Lance comes to us with a great background, and I'm very excited to introduce him to you today. He is a Senior Lean Six Sigma Project Manager for Memorial Health System in Springfield, Illinois. He is a certified Lean Six Sigma Black Belt, and he comes to us today with that experience, but also broad experience across healthcare delivery. His background includes the Lean Six Sigma operations improvement, clinical quality, IT project management, health information technology, application development, healthcare billing, and data management and analytics. Quite a range of experience, which makes him perfect to talk about this topic today. As you will hear about today, he is committed to identifying and developing new tools and techniques in support of both the caregivers in the hospitals and also the patients that they serve. So with that, I'm going to turn it over to Lance, and I hope you enjoy today's presentation.
Well, thank you, Brittany, and I'm really excited to be with you all today to talk about our journey and where we've went with building Simulate into an integral part of how we advance quality and safety at Memorial Health System. Just as a little bit of information about the health system, we are based in Springfield, Illinois, so right in the center of the state and pretty close to the center of the country, really. We are a community-based, not-for-profit health system, and we've got 4 hospitals, including a flagship tertiary care teaching hospital, where we're closely partnered with Southern Illinois University Medicine, so the medical center there at SIU. Again, just to give a little bit of scale, you know, we're not the largest health system out there, but hopefully that will help you understand that while these things are applicable to the largest, they're also applicable to even our smallest rural hospitals that are a part of our health system as well. And so we're really excited to share about our experience with bringing Simulate in. So kind of just pointing out what we're going to talk about today. We've taken a look and put together these 5 steps for success. So we're going to talk about those. We're going to go through each one of these, lay out what are the key points for each one of these steps, and how can you take the practical application of those steps, plus some of our learnings and our knowledge that we've attained over the last few years, and so learn from our successes and some of the things that maybe we could have optimized a little bit at the beginning. So we're going to share both of those aspects with you. So we'll talk about our initial use, we'll talk about how we advanced our knowledge, how we were able to get engagement and growth, and then what are those projects that are going to build upon. And then as we go through this, we're going to talk about different model ideas. So where were we able to apply this within the software? What were some of the problems and questions that our leadership were bringing to us that we were able to solve? So you've got not only the steps to get there, but the practical application of the software in operations. So with all things, the first step, step 1, we call this give them a taste. And it really is that appetizer, that getting this out there. Quite frankly, discrete event simulation is something that a lot of people just don't normally think of on their day-to-day days in operations. You know, for those that are new to Simulate or new to this modeling concept, discrete event simulation is what Simulate is. It's a means of modeling specific discrete time-based processes. So, you know, one of the practical things is so you've got discrete event simulation. Okay, how do you brand this? How do you get this in the vernacular of your culture? So one of the things that we've done is we've referred to it as the software. It's Simulate. That is our discrete event software, and it's really become part of our vernacular. To, you know, when you refer to Simulate, people know what that is. Another one is virtual simulation. So again, understanding the concept of especially in healthcare, we have so much simulation, and when you're talking simulation, are you talking about the simulation that we're doing within the training of the clinicians, or are you talking about this other computer-based model? So again, getting those clarifying terms and coming up with some way that people are going to be able to identify that. So computer-based simulation or virtual simulation is another one that's really caught on here at the health system. But for the most part, we even use it in terms of verbs. We're going to simulate that. So it's definitely a part of our language and a part of our ways of improving our operations. But the thing definitely to take away from this is it's not a trivial investment. Not so much necessarily the software, but it's everything that goes along with building this program. This isn't something that, just flip a switch and it's there. There's quite a bit that goes into this from a training perspective, from a resource management perspective. So we certainly encourage you to understand that and take those necessary steps to build that in and to be strategic about it. But the number one step is to get something there. Because again, this is an abstract concept for most people that initially are looking at this. You're talking about simulating something. Most people are thinking in terms of physical simulation. So to get them to understand what it is, you have to start somewhere. So our key takeaway from this is establish a business case. Identify that strategic, challenging question, that thing that everyone's kind of aware of, is kind of a thorn in everyone's side. Maybe we've tried some things in the past and they haven't worked. But make sure that it's something that's it's challenging, but it's not cumbersome as well. So you don't want to try and boil the ocean with your first model because you want to get a quick win here. But you're going to use Simulate to provide that direction. A good candidate for a project is one that's puzzling your leadership, but it's something that's going to help guide them in the right direction. And some examples here are the stereotypical flow of patients in a clinic. You've got a single clinic, a single physician or provider that is doing a specific task, say it's primary care. How do we optimize the flow of those patients through that particular clinic? Or maybe some other business process from, say, optimizing staffing. Some bad examples are ones that are too complex. If you're trying to show how you can solve your readmission issues, that might be a little bit too big of a bite for your first project. Although, if you're successful with that, that's a huge applications as well. But if you're just wanting to identify a quick project, give them a taste, give them something to start with, give them something that they can actually identify with, and that they can see this abstract item as having some concrete application. So after you give them a taste, we'll talk about how you take it to the next step. But from our perspective, what we've got from what we did is we brought Simulate in, and we were looking at how we were going to model and optimize flow in our new OR suites. We just got done with a major renovation of our peri-op space, adding several new ORs and making the flow much easier from the clinician perspective and making it better from the patient's experience. But Simulate was an integral part of this. One of the things that came out of this and early uses of Simulate was we identified several constraints, and you see here an elevator. Initially, the plan had 2 elevators taking our patients to and from the waiting area down into the peri-op space. And what was identified by using Simulate is that with 2 elevators, you were going to have bottlenecks with our peak times of waiting for elevators, both down to the peri-op and then back up to our PACU spaces. And so we were able to adjust our plans and add a 3rd elevator. And the key takeaway from our organization is what would the cost have been to add an elevator 6, 8 months, a year afterwards, knowing that that bottleneck existed? We were able to avoid an immense cost to the organization. People took notice of that. People understood that that decision could not have been made under the current ways that we were able to identify constraints and look at our processes and look at our flows through that. So this was an excellent point from our perspective to get Simulate in, to look at it. Again, the catalyst of this was we had a problem to solve, and that's truly what you're going to be looking for, is that problem that you're wanting to solve, or having some type of quantification to guidance that you're providing for your leadership. So as I said, after step one, you're going to what we called learn the tool and build on successes. For those of you that have been in Simulate, hopefully you agree with this assessment, but it's a fairly intuitive program to use. From our perspective, once we first give it to our staff members, for the most part, it's just like working in Microsoft Office for the, especially with the mechanics of the software, the ribbon, how it's working. But for building basic models, it's very easy, but you want to take it to that next level. There's an immense potential that exists for building on and replicating your complex processes, that you can use the software to help answer those types of questions like I had talked about earlier, such as readmissions or some of the other really major things that are happening in healthcare. These initial models are easy to put together. The hard part really from the early models perspective is the prep and the data collection. That's going to be your hardest part with your first models, which that's the hardest part of any one of these types of projects. And we'll talk about ways that we made that a little bit easier for this. But we want to provide an avenue to analyze and test those complex solutions for those trickiest issues. And what we found is that you really need to find the right talent to do that. So what we made the suggestion here is identify that staff member or staff members who can take the time to learn the complexities of the tool. And you're going to build on those more complex models. Consider modeling a single PCP's office for flow optimization. It's pretty straightforward. You've got one doc, you've got maybe a tech or two, or an LPN that's assisting. But for the most part, you're dealing with fairly straightforward constraints and bottlenecks. But what if you have a multi-specialty clinic? Maybe you've got a dozen of different providers or specialties that are going on, and you're looking at how do we manage our costs and how do we optimize our staffing across these disciplines. Maybe you want to know how does our work in these specialties integrate with our population health initiatives. Those things are complex, and those things require the more powerful aspects of the Simulate modeling part of the software. And you're really going to need someone that can take the time to learn the software, and just like anything, repetition makes everything much easier, and the person that's going to be learning and using this software really needs to have that time, have that skill set, find someone that's a little computer savvy, but also that person that's involved with the operations and understands how to interface and with your stakeholders. So it's really key to get that one person, and if that one person is you that you're listening, make sure that if your organization wants to move this forward, that you have adequate time to learn the tool, learn the complexities, and most importantly, share those successes. You're going to want to get those out there for individuals to know about what you did. So what did we do? We actually hooked up with NovaSim, which is a great partner in the Simulate space that's out there that does a lot of training, does a lot of education, does a lot of consulting with Simulate. And we attended a training that was put on at Barnes Jewish down in St. Louis. And Jarrett Haig was our instructor and did a really good job. And there was a handful of us that went down there and learned on a 2 or 3 day session on some of the basics. So starting from the ground up, how do you build a model, and then learning some of those more advanced things. One of the things that I can say is you really can't master the software in 3 days, but he certainly gave us a good platform to work off of. And so, find that partner, find that training outlet out there that exists, and invest in, again, if you're the person doing the modeling, get that investment in your training. If you are the leader that's going to be looking for that person, make sure that you're investing in their education and giving them those time, because it's going to reap dividends in what you're able to do with the software. And so an example here, one of the first more advanced software or advanced models that we did within the software, the question was, we've got in one of our critical access hospitals, they were dealing with the problem of how long it took to get the patient back to the room and seeing a provider in their emergency department. So that was the goal. This was a Lean Six project that was going on, and we were brought in to see, can we offer a model and test our solutions? That's really from a healthcare perspective, I find that's the most powerful part of Simulate, especially when you're dealing with Lean Six Sigma projects and you're coming up with these items that really you have these great ideas that your team is putting forth, but maybe they're a little bit unorthodox, or maybe they're a little bit out of the box thinking, and there's some concern that, oh gosh, the only way that we can test this is to get it in our patient population. Well, what Simulate allows you to do is to test those assumptions in as real scenario and have those repetitions from the discrete event simulation perspective, and really provide numeric, quantifiable evidence that your interventions will work or will not work. And there was actually about half a dozen or more interventions that we tested within these models, and what we ended up with is this vertical care concept where, again, for those that aren't really familiar with how emergency departments categorize their patients, you're essentially given a score from 1 to 5 on how sick you are, 1 being the most sick, 5 being the least. And we were able to test this model of putting the 4s and 5s through a different process. And the point here is not necessarily to talk about that particular process, but to point out from the simulations perspective, we were able to get within 1 minute of the actual results. So we gave them our estimates out of the model. And what we ended up with was what actually happened was within 1 minute of the actual results for those acuity 4 and 5 patients. That's an incredibly powerful tool to show that, yeah, this isn't just make-believe, we're not just doing all this work, but this actually had accuracy, and that gets incredible buy-in. You know, this was a complex innovation from our perspective, because we really had done a couple of things from modeling perspective as it related to physicians. And the physician workflow, for the most part, if you're comparing apples to apples here, the physician workflow is a little more predictable in the emergency department than the nurse's workflow, just due to the fact that the nurse is going to be called in to get the patient anything from their meds to helping them with their pain control to maybe helping them go to the bathroom or getting them a glass of water. So it's really much variable, and we had to simulate that variation within the model. And again, we were able to get within 1 minute. So the point of this, from your perspective, is we wouldn't have been able to model this had we not went to that advanced training, had we not had someone in myself that was spending more time with the software, understanding how to build these models, how to take advantage of the more advanced aspects of the model. And then once we were able to build this, we were able to build on our success. We let everyone know that this is what we were able to do with this model, and it really gave us a great platform of having that success track record to build upon on future models. So step 3, if 1 or 2 are important, step 3 is what's going to make or break your program, is getting your stakeholders engaged. You know, building models for smaller specific cases, there's limitation in your exposure. You're working with single teams, or maybe there's some slight cross-functional aspects to those. But for the most part, those are great to get your program started. It's required to gain trust. But what you really need to do is get higher exposure projects and really engage your leaders in the process. So early on we said we identified that important project, but really we were looking for something a little simpler. Here, this is a key, large-scale, cross-functional project. Now you're looking for, at this point, you've got your legs under you. You've got some experience working in the software. You've got some successes that you can build upon. This is where you're trying to tackle some of these major things that are happening within your organization. But that's not enough. You have to have your leadership engaged and have that organizational buy-in. And it's through this process that, and them seeing how this all works, that you're going to start gaining that knowledge within their perspective and also gaining their trust. So we talk about the importance of having the stakeholders from your leadership and having them at the table, but it's not just the leaders that need to be engaged. You need to make sure that it's all of your cross-functional members as well. So we've got here Use Your Red Team. For those that aren't familiar, this actually was something that started in the military, and from their perspective, as they were getting ready to go out on missions, they've got a plan for everything. And what they would do is they would plan with their team, and then they would actually get a panel of people that weren't involved with the planning aspect, and it would just be getting in front of them and asking them, where can this go wrong, essentially. So we've started to use this concept within how we at Memorial Health System are working with our modeling process. So it's, again, it's that independent group that challenges an organization to improve its effectiveness. So once your team is behind you and once you've built this model, there's a little bit of groupthink that's actually happening within there. There's everyone that's bought in, and sometimes you can't see all the different nuances that might be going on. And we actually had this on a project that I'll talk about in a moment. Really encourage you to get cross-functional members taking a look at this, because not only is it good for your model, what it's even better for is now those individuals are engaged. Now they can see the work that went into this, and whenever it's time to implement your solution, they've seen all the aspects that you've put into the planning and the building of the model, and they buy into it now. And not only are they buying into it for that particular project, you've got them now as a supporter for your overall program. So the next time you want to do an intervention, they're going to be the ones that are going to say, well, can we model this? Can we simulate this? You're not necessarily going to be the one that has to push it anymore. It's going to be pushed to you. And it's important to consider that. So our placement project, one of our big project, our major thing that happened within our organization is we were dealing with trying to find beds and getting patients assigned to those beds. And this was an incredibly complex project due to the fact that it touched every aspect of our inpatient stay. All the way from admitting someone from the emergency department to bringing someone in from some of the rural hospitals and accepting those patients, moving our patients around from downgrades and upgrades, an incredibly complex project. And we had an incredibly complex process that we were looking at. And quite frankly, the team was running into organizational resistance with this. We built the model based off of the intervention, and essentially the intervention here was we've got a situation where we are applying a specific prioritization to our patients, and that prioritization was ultimately having a negative impact on the overall performance of our patients moving through our organization. So when we built our model, we built it with the understanding that we're building it under this intervention, which we moved to first in, first out from their queue. No longer are you going to place a particular priority on a patient outside of certain, and there were exceptions to the rule. Obviously, if you have a patient coding, that patient's going to get the care that they need. But from a general perspective, we identified what those exceptions were. We built them into the model. But this was incredibly against everything that our clinicians had put in their mind. It was something that was, they just didn't buy into the intervention. But that's why we built the model. That's why we're able to test this. Again, the key here, the power here is let's test these things before we put them into into practice, so that we have quantifiable evidence that we're going to make patient care better, not make patient care worse. We added our key leadership. We actually had several members of our senior leadership team going all the way up to from our chief operating officer at the table, engaged, asking us questions. We had the red team going on, asking, okay, where is this model wrong? What have we missed? You know, We added such things as block beds. Initially, we didn't have that in the model, but the team pushed that forward. And so the idea that, okay, well, engineering is going to have to shut a bed down every once in a while to fix something. You got to take that into consideration. You need to take into consideration, again, those patients that are crashing on a general floor and get them to the different areas. So by the end of this, we had such great engagement. And the thing to take away from this is that it was that big, complex, cross-functional model that was using some of the back-end programming, had 50 custom distributions that were built. And what we ended up able to see is a 23% reduction in the mean in the time that it took to get a patient to bed. And again, our model predicted approximately a 30% reduction, and we got a 23% reduction that came from this intervention. So the takeaway from this is we would not have been able to do our project and have that success without Simulate. But we wouldn't have been able to even get past the Simulate model if we didn't have the engagement of our stakeholders. If they didn't understand everything that went into it, if they didn't have that buy-in and be that voice at the table and know that their voice was being heard and to see the effect on the model, then they were able to buy into it and say, you know what, I'm at a point now where we can pilot this. So it's incredibly important to have your stakeholders. So we got through the first 3 steps. We gave them a taste. Then we got involved with the software. We learned it a lot more. We got engaged, and then we got our leadership engaged. We got our staff engaged. So that's how we launched our program. But then we were sitting here with a handful of projects that had been done, and quite frankly, we didn't really have a way to grow our program. So what we ended up doing was we used the DMADV structure. So Memorial Health System is a huge believer in and utilizer of our Lean Six program. And so what we decided to do was to utilize that and to go through what's the DMADV, or the Define, Measure, Analyze, Design, and Validate, to come up with those step 4 and step 5 that we're going to talk about. So again, we've got our business case, and I'm not going to read through all of this, but the point here is that it was necessary for us to do this to increase our use of the software so that we could diversify its use, so that we could get more people using the software, so that we could lower our risk of our implementations within our program. We wanted to ensure that our patients were getting the most high-quality interventions. We knew Simulate could do that, but we had to ramp this up even further, and so that's why we went through this project. So again, our problem statement was we had 2 people that knew how to do this software, and we only had 4 projects at the time that we were starting to do this that had really been went through the program at this point. So we really needed to ramp things up to start seeing the benefits of Simulate. And this is just another graph to show that most of our stuff was done in the emergency department or the OR. We really wanted to get more people out there. So we reached out. We got what's called VOC, or Voice of the Customer. So from our leadership perspective, they didn't really know what was involved in building a simulation. Again, it was very abstract to them. We were actually starting this project at about the same time that we were doing the placement. So we were coming up with step 3 while we were trying to get step 4 and step 5 going on. So you can see why the leadership really didn't know, because they hadn't been truly engaged yet. It was that placement project that really got them engaged. But it was good VOC to get from them. They knew that projects and interventions needed to be data-driven, and they needed to be quantified, and that we needed to limit the risk on our patients by testing these things. From ops improvements perspective, we knew that we needed to have this, but we needed to have a standardized approach. We needed to make sure that people were coming to us in a standardized way to use this software. And we needed to increase our product use, so we needed to increase the use of Simulate. From process owners' perspective, they've got all these Lean Six efforts going on. We don't really know their interactions. We need to be a way to be more confident in the results of these projects. That's where Simulate came into play. And from our belts perspective, it's a complex tool to do these more complex projects. So we really hadn't set them up and given them good keys to move forward. So what did we do? We sat around and we went through the steps of Lean Six, and we came up with this affinity diagram. What were the things? These were the improvements that we were going to go through, and I'm going to talk about each one of those as it fits within steps 4 and step 5. So step 4, build standardization and clarity. You've got engagement. You've shown them what it does. You're feeling more confident as a user because you've taken the time to learn it. Now it's time to standardize. So one of the things that we've done is we've actually integrated this into our Lean Six projects model altogether. It's a part of what we do when we're looking at Lean Six. So when you're going through to define and measure, you're saying, is this something that we can simulate? Is it something that's going to benefit from a simulation? If it is, then it's going to change how you do your measurement plan for your Lean Six project. You're going to start gathering that data as you're doing your other measurement. You're going to start building the current state model. So as you're going through your process mapping within measure and analyze, you're going to start building that current state model. So then when you get into analyze and improve, you're going to build that, you're going to finalize that current state, you're going to identify your bottlenecks, and then you're going to brainstorm on what are those interventions. Remember, simulate isn't this magic tool that's just going to spit out the interventions for you, although there are some really cool features that will identify bottlenecks for you, and it will point you in the right direction. But the bottom line is that once people understand that it's not this magic box, then they become more engaged and like, oh, well, can we test this? Oh, can we test that? So by building it into our DMAIC structure, it was really helpful from our perspective because people were able to identify that with that structure. So then you build your future state and you test that. You get it in front of your red team. You make the changes to the model to the point where you're ready to trial. You're ready to pilot that in real life, but you've got data that can validate those interventions. So building it into our Lean Six structure has been incredibly valuable and incredibly successful for us. And by standardizing it with those steps. The other thing is when do you use it? Again, simulate is incredibly powerful, but it also takes some time to build them. So quite frankly, people were bringing things to us that were incredibly complex, and they were bringing things to us that were incredibly simple. I actually had someone stop me. We're opening up a new building for one of our finance areas, and they asked us, hey, you know, we've got this break room, and we want to know how many microwaves we're going to need. So it becomes a situation where people start identifying the power of the tool, and that's simulate could absolutely answer that question. But do you need to engage a simulate team to answer that type of thing? Likely not. So you've got other things. You've got simple queuing analysis that you can do within an Excel spreadsheet. So we wanted to apply guidelines. So again, for discrete event simulation, pardon me, DES, this is full department or system analysis. This is multiple constraints, multiple things that you're looking at. It's complex, full service lines, things that you're looking at the utilization of resources. Again, if you're looking at optimizing flow and you really don't have a lot of resources that you're worried about, it's more just the sequencing of events, and it's a simple process, do you really need to engage a simulate team and have those subject matter experts building those models when they could be working on other strategic items? So you've got the simple queuing analysis. It's a specific issue. Maybe you've got a machine, or maybe you've got, like, say, registration, where it's pretty straightforward. Singular wait times, non-complex models, static models or analysis, things that aren't really going to change over time. So it really gave our stakeholders an understanding of when do we do this, and quite frankly, it gave our simulate people as well an understanding, and our belts an understanding of when you're going to use one versus the other.
Lance, can I ask you a quick clarifying question there?
Sure.
Has your thought process about when to use discrete event changed over time? I mean, you talked earlier about starting with small, simple projects and gradually building up. Has your mindset changed about what projects you accept or don't accept as it's grown, or has that been pretty consistent?
Absolutely. Starting out, you're going to, you know, maybe you start with the microwave question. Again, you as a person using the software are learning. That's a good learning opportunity. As you mature in your organization's use of simulate, though, your demand for simulate is going to increase as well, and so then you're getting to a question of resource constraints. Not everybody knows how to use simulate. Excel's for these very simple things. If you're just plugging in 2 or 3 numbers, I mean, that's a quick turnaround for answering some of the questions. So absolutely, it's a great clarifying question. You're going to start off simple, but once you get to the point where you're maturing, you're really going to want to standardize on its use to make sure that the people that know how to use the software the best are focused on the most complex questions. So start off easy, get some quick wins, but then after you move forward, you really want to take into consideration how to use your resources appropriately.
Awesome, thanks.
So one of the other things that we got from our folks is, okay, we don't really know what goes into this. We don't know how we can help you as a simulate modeler. So we came up with standardization of inputs and outputs. So again, you need to know your process. You need to know those entry points, and specifically, we need to know the arrival rates. From the activities perspective, tell us what those durations are. And you know, one of the hardest things is people will give you a number, but you really need to know the type of distribution that you're dealing with. So you know, encourage them to give you the raw data as well, or if they're more advanced in their statistics, ask them for that distribution. What are your waiting points? What are your capacities, your min-max wait times? From a resource, you really need to understand what are those resources that are having an impact on your process. What are their shifts? What are their counts? What are their purposes? You know, building this into our Lean 6, it was able to really help with some of the latter things here of what are you wanting to test? What are your critical X's? So in Lean 6, critical X's are those things that are having an impact on your process. What are those things? What are your constraints? So attributes and qualifiers. So again, if you're worried about the impact of ESI on your emergency departments, are they a 1 or 2, so the most sick, versus the 4 or 5, which is the least sick? But you need to know what those things are so that we can build them into the model. And quite frankly, one of the hardest things is people say, hey, we need to simulate this, but they're not really thinking about what it is that you want to know. So what are the results that you're looking for? And some of these things, again, are going to develop organically, especially around the results. So as you're building the model, that's going to trigger more questions in their mind. But at least having a general understanding of, in Lean 6 we call it, what is your project why? What is the specific metric that you're wanting to test within this model? Because again, that's going to help you as a modeler understand what's the most efficient way and effective way to build this model. So are there times, are there counts, are there lost items? What are those results that you need? So by putting this in front of our stakeholders, putting this in front of some of the belts like our white belts or our green belts that aren't necessarily modeling, but they're obviously an integral part of our improvement processes, this was helpful. It helps for them to understand once I come to someone that's going to do the modeling that they have what they need, at least to get started. So once you've standardized, once you've gotten some clarity out there amongst the group, once you've got some of those early things under your belt, you're doing some more complex, you've got the learning, you've got all these things in place, now it's time to ramp it up. Now it's time to get more people using it. Now it's time to make sure that you have the capacity in your organization to take care of this. So what we did first is we created an education system that was tailored to us. Now, this was very helpful for us. We ended up using Nova Sim's book for our more advanced modelers. That Nova Sim book is incredibly valuable, but it's so thorough that we really wanted to start off with some just basic materials. So let's give them a basic course, and then after they've got some of that down, we'll get them into these more advanced knowledge and provide those more advanced pieces of information. Another thing that's incredibly valuable is Simulate's got chat boards and your online help. Again, it provides examples. It provides places where you can ask a specific question and get feedback. So those have also been very helpful. But to get more people using it, we came up with our own guide. We went through within these materials and talked about what are the basic elements of the software and what do they do? What is an activity and when do you use it as opposed to a queue? What are some best practices in building your models? What are the different distributions? So we also kind of tied in some of our statistic aspects. So when are you going to use a normal distribution versus when are you going to use an exponential distribution? How does a Poisson distribution fit into all of this? So we get into that within our our training. So it was more of a practical application for Memorial. And again, it's something to consider within your organization to look and see how can we build an education structure and support. So not only was it just materials, we also built in a structure in place to where we're bringing our belts together that are trained on this software, and we're sharing our lessons learned. We're talking about how did we do certain aspects and solve certain problems within the software. What were some of the nuances of the software that we're learning about? And then one of the things that we've started doing is having lab sessions. So initially, we had our first lab session, and it was more of a kind of Q&A, and I was up in front of the group building a model where they could watch. Our subsequent was we got our group together and actually had them building a model with us. So we had a group of our 15 or 20 black belts that are trained in the software, and we were actually solving a problem. It wasn't just a test play model. It was this is something that we need to fix, so let's all get together and let's build these models together so that you get those repetitions and understand some of the nuances again, and we can all learn together. Improve technological access. So, starting off, we had 1 or 2 licenses for the software, and they were local installations on, the 2 practitioners' laptops that were doing this. Well, that becomes incredibly cumbersome when you're trying to get more people to use this. So one of the great features that Simulate has from a licensing perspective is they have the network license. So again, we take those 2 licenses, we got a 3rd license, and now all of a sudden, instead of trading laptops, you are able to access, again, you only have 3 licenses, but you're able to access the software so you've got 3 people in it at one time. Not everyone's using Simulate at the exact same time, so it was incredibly helpful. Also, if your organization has Citrix, we've installed it to our Citrix environment, so we don't have to worry about those local installations. We're able to get it in the hands of our users. Again, you still have the 3 licenses, but it's something that's been incredibly valuable for us from getting it into the hands of the users. And so, again, not everybody has the Citrix environment, but I would recommend the networking license structure to look into that. And then if you haven't done a lot in Simulate from the visual logic perspective, there's a ton of ways that you can integrate Excel into this. So one of the things that we wanted to do is get Simulate into the hands of our business users and allow them to integrate with the software. Now, that's kind of hard to teach them how to maybe change some distributions or alter the model in some way or fashion. So what we did is we started building these templates. We built these dynamic templates in Excel to where they're able to modify a distribution, run the model, and it's that interface back and forth. So again, one of the more powerful things that you can learn is how to integrate this within Microsoft Excel. And then finally, encouraging more use in diverse situations. One of the best things that we've done is integrated in with our Lean Six structure. And we've kind of set up roles. So what is a white belt's role in this? What is a green belt's role in this? For those that don't have the Lean Six background, white belt is kind of just an entry point. Some people have yellow belts. Then you go to green belt, then you go to black belt. And you're increasing in complexity and statistical analysis. So we've got our green belts with the role of they're not necessarily building models, although some of our green belts are trained just due to their interest. But the expectation is that the green belts aren't necessarily building models, but our black belts are. They're all trained on how to do this. And again, some are more advanced in their knowledge than others, but it's an expectation that when you go through, we've built it into our black belt education program. When you go through our black belt, you're going to learn Simulate. And there's an expectation that you're going to at least be able to build simple models. It's built into our test. So we've integrated it in. So if you don't have a Lean Six structure, I would recommend that you have more people that are trained. Get more people that are interested in this, trained on the software. And then increase the complex modeling and programming. Visual logic is an incredibly powerful part of Simulate. We encourage you to at least have one person that knows how to do that, so that you've got that master modeler that can build these complex parts of your models.
Lance, so can I ask you?
Sure.
Just to clarify the roles, how does it work? Do you have people referring models to you, or do they? Like if I'm a green belt and I identify an opportunity, do I start a simple model and then hand it off when it gets too complex, or do I roll it up the food chain until somebody says, yes, I can do this? How does that work?
It's more of the former. So you again, the green belts, we've as a part of their education, they're taught when to identify, when to simulate models. So again, when we go back to the slide where we had it built into DMAIC, it's a part of define and measure. When you get into define and measure, those belts are identifying those opportunities. We've even gotten to the point now where our leadership are coming to us and saying, hey, we've got this issue. They've seen enough of these models to understand when it is and it is not appropriate to use simulate. So they might bring just a model, not necessarily tied to a project, to us. But for the most part, what's happening is green belts start on the project. They identify that modeling is something that is needed. Then each one of our green belts has a black belt mentor. And so the black belt will sit down and look at it, and they might start to build it. If they need to do more complex things, they'll reach up the food chain. But for the most part, it is that identification of need and then identification of skills. So the identification of the need happens with the green belts or with our leaders, and then we start with our black belts, and then if there's something more complex, then we move it up to our more advanced users.
Awesome, thank you.
So we've got a histogram here. You can see this was actually a histogram that we had put together 2 or 3 months ago, and we've got a ton more projects that are going through the pipeline. But you can kind of see here, the bottom x-axis, this is our acronyms for our different hospitals. So we've got Abraham Lincoln, we've got Passivant Area Hospital, we've got Memorial Medical Center, and then we've got the health system in general. So we're doing some cross-health system projects as well. So we're using it at all our hospitals, we're using it at the health system, we're starting to use it in our ambulatory spaces as well. So we're really seeing some fruits to our labor here. So real quick, I know we're getting close to our time here. I'm just going to touch on some additional model ideas, again, just to give you some ideas for those that haven't used the software or maybe are not familiar with or struggling with ideas for this. So one of the models that we've got here is our front entrance. So when we redid our front entrance, one of the questions was, okay, we've done a queuing analysis to know how many lanes, but quite frankly, we don't know the right process and utilization of those lanes. So they knew they needed 3, but they didn't know maybe the right way. So we built a model for this, and we identified that, hey, the outer lanes can be for your slower traffic, the inner lanes can be for your inner traffic, and we actually built a couple of different interventions to show that there is a statistical difference between one model versus another. So again, the innovation here is we used it on a facility project, and we really used this was the first model that we really used Excel as a way of getting it into the hands of our business. When we built our new tower, we built a brand new bed tower for inpatient care, and one of the big things here is this was a much larger floor plan than any of our units have ever been. So the question was, okay, how do we assign nurses? So the real impetus behind this was not necessarily flow of the patients, it was more what is an equitable way of assigning our nurses to make sure that, before you've always taken into consideration acuity, you've already taken into consideration the number of patients and et cetera, but what hadn't been taken into consideration, at least formally, was geography. So this was a way to model this and say, okay, what is the most equitable way for us to assign our nurses and build the process for filling out the room utilization? This used a lot of back-end programming. This has several processes that are simultaneously happening. So again, in order to model this, we had to understand and constrain those nurses. So we've got the process of where they're being put, and then we've also got the process down below of the work of the nurse. So we've got parallel processing that's happening and a lot of integration with the back-end programming and visual logic. Block scheduling. This is something that is a fun challenge for everybody from a peri-op perspective. So one of the questions here was from our special procedures area, how are we going to optimize our volumes? And so we've got this model that's built to flow patients through, and what was innovative about this model is we've actually got this integrated in the back end to where we've got physician profiles that are built. So physician A sees this many with this type of anesthesia, and their normal breakdown for their procedures takes so long. And we're able to swap docs out to say, okay, if we take block time away from this physician, what does it mean for the physician? And what does it mean for the organization? So is the physician still going to have an adequate amount of time to take care of their patients? And what is the impact to the organization? So we're able to see what happens to our margins from a financial perspective, and always foremost, what is the patient experience? And we're able to build all of that into the model. And then finally, I wanted to share this one. Just again, these are ideas. These are things to show that it's not just throughput. There's different questions that you can answer with this. We're building a stroke communication. So Memorial Medical Center has the Joint Commission's Comprehensive Stroke Center accreditation. And so what we're doing here is answering the question not so much about flow, but it's the question of how does communication impact our patient care. So if we have a certain success rate with a communication step, and you can just think from door to CT, what are all the different communication steps that are integrated in this, and what are their failure rates? And do a probability analysis. As you're going through this, if one of these steps fail, even if, again, you're talking about a 99% success rate, those 1% add up, and ultimately, what is the impact on the patient? And then if we can clean those up, if we can fix those, what is the impact going to be on the patient? So this is more abstract. This is less about trying to answer a question of throughput. This is trying to answer a question about clinical effectiveness. And Simulate provides you with that kind of flexibility to answer all of those questions. And so I thank you. Hopefully we've been able to provide you with some practical steps, some practical advice, and also give you some ideas for some models and different things that you can do within the software, because it's incredibly powerful. And you know, some of the other work that we're doing that I wanted to mention as well in the stroke is we've actually paired this with our we've got our Memorial Center for Learning and Innovation that you can see there in the background. So what we're also doing that's very innovative is we're tying not only the work that we're doing from a virtual perspective, but then we're going to go and live simulate it. So we're going to test these things. We're going to see where the interventions can provide us with some direction on improvements, and then we're going to take them into our state-of-the-art simulation center, and then we're going to test them with real clinicians and see what truly is an expectation from an improvement perspective. So tying both the live simulation and the virtual simulation has been, again, incredibly powerful. We've done this once before with RAAA, which is ruptured abdominal aneurysms, and we're going to continue this work for improving our patients. So that's our presentation today, and I look forward to answering any questions that you guys may have.
Wow, awesome. Thank you, Lance. This has been great information. I'm really glad that you were able to share all of this today. I do have a couple of quick questions that have come in that I want to try to cover real fast. I've had several people ask about the size of your simulation group. How many people are in your core quality and safety team? And then within that, how many people are really focused on simulation, or are you doing multiple projects at the same time? How does that team work?
Sure. So we do have a core quality operations team. There's 4 of us, and if you count our leader, there's 5 that are all trained to do the more advanced simulations. And obviously each one of us has a different focus, but for the most part each one of us has the ability and focus to do simulations. There's probably 2 or 3 of us that are really focused on the Simulate software. So if you're thinking in terms of those that are doing it the most, it's the 4 or 5 of us. And then all of our black belts are trained. So there's 15 embedded black belts throughout the organization that are trained to do models. They're more of the basic models, but again, they are trained on the pretty much everything except visual logic within the software. And then we've got our green belts, and we've got over 100 green belts. Again, they are identifying when projects are meeting a model. So we've got trained people that know when to find them. We've got 15 people that are actually building models, and we've got 4 people that are building more advanced models.
Awesome. So I would just want to reiterate that actually it's really interesting, because when I speak with different organizations that are doing simulation actively, I find that the ones that are most successful have some sort of core team, but also the disseminated knowledge, right? Because you need your core team is not going to see every opportunity, right? And you need that balance. And I also have found that it seems to be much more successful when you have multiple people, 2 or 3 people who can use the tool, right? Because then you can share the workload, you can bounce ideas, you can learn from each other, and that seems to be really successful. So it's interesting that you say that, because that is, I think, a pattern across the country. The other question that I want to ask you about, I don't know, tell me what you know about, and you know, answer the piece of the question that makes sense to you. So somebody's asked, you know, specifically, we're talking about Simulate. There are a variety of tools out there for doing simulation of various types. What, in your experience, has been the advantage of Simulate, or can you speak about what you think is the most powerful aspect of Simulate if you haven't used some of those other tools?
Sure. So we've looked into other tools, obviously. What's really drawn us, you know, there's some competitors out there that maybe make flashier graphics. That's kind of what I've seen is, and Simulate will do 3D graphics. But you know, there's some that are out there that might have a little flashier graphics. There are some out there that you know, are a little simpler. They don't offer the power that Simulate has, but it might be able to give you the opportunity to do some basic modeling. What I find Simulate does is it's giving you the ability to answer the questions, and to do so in a user-friendly way. You know, open source software that exists out there is cumbersome to use. Quite frankly, if you want to make a flashy, pretty model, usually those are people that have an extreme amount of time to focus on those, because graphics take time to put together. What I find with, and we've got a term for that here at Memorial, we call that geomapping. So it's building a model on top of, instead of just the process map, it's seeing how it integrates in with the physical space. So where I find that is helpful is the first time maybe that you're trying to get your team engaged and they can actually see physically how the process will work. But what I don't find them useful is actually answering the question, because in order to answer the question, you have to have so many repetitions of this through so many different cycles, and really the power of the tool is to answer those questions. And to sit there and watch the virtual or the 3D over the course of 3 or 4 hours run isn't really effective, as opposed to building the process in, answer the question, and can be done in again, depending on how much data, from seconds, mere seconds, to a couple of minutes for it to run. So where I find Simulate does an incredible job is its integration with other tools, like you know, you can build ODBC connections, which is a way to connect into databases. You can connect with Excel. You've got the ability of doing back-end programming within Visual Logic, so it gives you that flexibility, but it also gives you the flexibility of just getting in and building a model for those that just want to get in and build some basic things. So it covers the gamut, and I don't find an incredible amount of value in doing some of the more flashy 3D stuff, just due to the fact that it takes so much time, and it really doesn't answer your core question of how do we make the business better.
Awesome. That's really helpful. Thank you. Appreciate your honesty about all of that. The last thing I will just ask you, you were talking about choosing projects and when it's appropriate to use simulation and when it's not. How do you keep from offending somebody when you say, no, actually, this isn't the right application? How do you handle that relationship and that dynamic? You
have to have options. So we don't necessarily just say, no, we're not going to do it. You're going to provide them with options. So again, we've got the two different, and again, we talk about Simulate, and then we talk about our queuing analysis. Sometimes it's a regression analysis. Sometimes it's another tool. It's another statistical tool that's out there. So we're never usually just going in, and so like for the microwave example, you know, we didn't say no, we weren't going to do it. But when we get into that situation, well, you know, we can do this within our spreadsheet and do it in 15 minutes, as opposed to you know, spending all this time trying to build out the model to the nth degree that for microwaves. So again, you really want to manage those relationships. You want to keep them engaged, but you also want to be frank and honest about what goes into these models and what is the best use of your resources time. Because once people get a hold of this and learn about its power, you're going to have demand for it. And then it's a question, again, when you don't have demand, yeah, do those other things because you're trying to get people engaged. But once you have the demand that exists out there, you really need to manage that. And the best way to manage that is to offer options, offer different solutions. I would highly recommend that you don't just say, no, we're not going to do it. Offer them different avenues for accomplishing getting the answer that they need.
So use the right tool for the right situation.
Correct.
Perfect. Awesome. Well, thank you so much. We are out of time. We do have a couple of other questions. We will move that conversation to the LinkedIn forum, so please join us there. If you have any other thoughts or questions or you want to catch up with Lance, we will be there. Thank you, everybody, for your time, and have a great day.